Hello everyone, this is Faisal Rashid, and today I'm going to talk about some important topic that is included in pharmacy. So that is biological and pharmaceutical importance of vitamins. As vitamins are concerned with our daily life for many functioning of our body, like nervous system, bone health, and many other functions that will be discussed in our video today. So before starting our new video, so we should, if you are new on my channel, so please subscribe my channel and press the bell icon for more interesting video. So let's see. So first of all, we will discuss about the biological importance of vitamins, as vitamins are concerned with our many daily life functions. So let's see that what are the main points of today's video. Number one, that is included in importance of vitamins, that is the prevention of night blindness. As the word indicate, that night blindness, you may have an indirect meaning from it, that night blindness doesn't mean that you won't be able to see in night. It means that if there's a high ratio of a darkness in a specific area, so the material, or you may say the matters present in that area, you would not be able to see that matters. So we can say, we can call that night blindness. So how it is prevented? Let's see some important vitamins like vitamin A. So the vitamin that is needed to convert light that hit our eye into electrical signal that can be sent to your brain. So the light which is converted into electrical signal, that is converted by a vitamin. So a night blindness occurs in people with vitamin A deficiency. Now, as I have discussed, that it is prevented by vitamin A. So if we have vitamin A deficiency, we would be having a night blindness. So a deficiency, so as a vitamin is a major component of the pigment rhodopsin. Rhodopsin is present in our eyes, so that work in the dark light, or you may say the dark that may work in darkness in a specific area. Rhodopsin that is found in retina of your eye and extremely sensitive to light. So it is sensitive to light, which means that it converts the light into electrical signals. Other includes that are concerned with vitamin A. So it supports our immune system and reduce the risk of acne. Acne are the major problem that is arising in our generation. So it can be prevented by the use of vitamin A, or you may say a normal amount of vitamin A in our body can prevent the risk of acne. Support our bone health, that is number 2 point, which is included in my video. So bone health means that it has a specific role which provide a structure, which provides structures to our body and protecting organ and storing calcium, that is the main function of our bone. So it is concerned in, or you may say it is included in bone health. The key nutrients needed for maintaining bone health as you age are protein, calcium, and vitamin D. So the nutrients which are really important, or you may say which are needed for a normal healthy bone, these are protein, calcium, and vitamin D. Vitamin D has several important functions. So as vitamin D is not concerned with a single function, so it has many functions. So perhaps the most vital are regulating the absorption of calcium and phosphorus and facilitating normal immune system function. So the calcium and phosphorus are absorbed into bones, so that is done by vitamin D. So vitamin D, we have a big source from of vitamin D, that is sun. Usually we place our kids in front of a sun in cold days, so that the bone gets strong and the calcium is absorbed into the bones. So getting a sufficient amount of vitamin D is important for normal growth and development of bone, as well as teeth, and improve resistance against certain diseases, as it facilitates the normal immune system function. So it can improve our resistance against certain diseases. So this was the two main points of importance of vitamins. So it is continued that we have some further points regarding importance of vitamin. So these are the healing of wounds. Also, if you define wounds, so wounds are the injury to living tissue caused by cut, blow, or other impact. So you may say that wounds are simple. In simple words, we can say injury that is healed by certain vitamin. Vitamin C, that is necessary for the synthesis of collagen. So collagen I will discuss right now. So it has an important role in the healing process. The vitamin absorbs iron and acts as an antioxidant. So collagen is like the main structural protein in skin and other connective tissue, giving a great tensile strength, and is a main component of cartilage, ligament, tendon, bone, and skin. So we can say that collagen is an important part of our body, which is synthesized by the presence of vitamin C. The sources which are concerned with the vitamin C that are orange juices, cherries, red pepper, kale, and grapefruit are some example of food which this popular vitamin is found. So we can say that these are the sources of vitamin C. We have a scurvy disease in winter season. That is just because of the deficiency of vitamin C. So our nature knows that weather changes can reduce our vitamin C in our body. So in winter we have citrus fruits like orange, guava. Guava is the main best source of vitamin C, so just remember it. And orange is fairer than that. So red peppers, these are the source of vitamin C. So we just have some kind of orange juice to have a full of vitamin C, that then after some days we are rid of that scurvy disease. Source of energy. As we know that many vitamins are the source of energy, like how they are source of energy, let's see that vitamin B3 precipitates in energy metabolism. Its primary function is to convert food into energy. It is important to know that this vitamin is absorbed in the intestine and stomach. So the vitamin that is that has participation in certain metabolism, that is vitamin B3, and its primary function is to convert the food into energy. We can say that an important needed for the conversion of food into energy is vitamin B3. It is also important to know that vitamin is absorbed in the intestine. So the place of absorption of intestine is of vitamin B3 is intestine and stomach. So good sources of vitamin B3 are poultry, tuna, salmon, beef, and legumes. These are the sources of vitamin B3. So as it is continued, so let's see another important function of, or you may say another important importance of vitamin, that is the maintaining of normal functioning of a nervous system. Our nervous system is an important part of our body. You know that everyone wants to have a normal functioning of nervous system. So the main factor involved in normal functioning of nervous system, these are vitamin B1 is an essential for the functioning of brain, nerves, heart, and muscles. So vitamin B is essential for functioning of brain, nerve, and heart. That is simple sentence. Moreover, vitamin B2, another vitamin that is important for the proper maintenance of nervous system and immunological system. Immunological system is an additional part in this point. So vitamin B2 and vitamin B1 are essential for the normal functioning of our nervous system. Another important function of the vitamins, that is for the normal functioning of body fluids. Body fluids are a collective term used for plasma, blood, and lymph nodes, etc. Lymph fluid. So the vitamin B12. Vitamin B12 is an important term which has a wide range of functions. If you want to know more about the vitamin B12, so it is really explained in my video, in my previous video. I'll provide the link to in my video about the vitamin B12. So it is a nutrient that helps keep neuron and blood cell healthy. In addition, it contributes to the elaboration of DNA, the genetic material present in all cells. Moreover, it also prevents the specific type of anemia, that is megaloblastic anemia, and it is present only in animal products such as meat, poultry, fish, dairy, and eggs. So the source of vitamin B12 is that. And furthermore, if you want to know about the drugs regarding vitamin B12, it is also discussed in my previous video. I will provide the link in my below description. As it is continued still, so the determination of coagulating factor, or you may say the determinant for the coagulating factor are really important for our to have a stoppage of a blood flow outside our body, or you may say a stoppage of our blood outside of the vessel present in our body. Vitamin K is produced by intestinal flora. It is a compound that is determinant for the synthesis of numerous coagulation factors, and it is necessary to store carbohydrates in our body. Vitamin K function like a cofactor in formation of the coagulating factors such as fibrin, prothrombin, thrombin, etc. So it acts as a cofactor while forming a coagulating factor by extrinsic and intrinsic pathways. So it is discussed in physiology. If we go to vitamin K function so in detail, so we will be diverted from our important topic. Vitamin K is found in the following food. The source is alfalfa, fish liver, cauliflower, egg yolk. These are the sources of vitamin K. So now we will discuss about the pharmaceutical importance of vitamins, as we have discussed about the importance of vitamins, that is biologically. So we will discuss right now about pharmaceutical. So vitamin B1 and diabetic patients, so these two terms are interrelated. Let's see how. So there is evidence of thiamine, vitamin B1 deficiency in diabetes. So it means that if a patient is diabetic, so he must have an evidence from the vitamin B deficiency. A high dose therapy with vitamin B1 in rat model experimented reduced diabetes in rats, prevented development of diabetic neuropathy. So when a high dose of vitamin B1 in a rat model means that a rat was induced diabetes experimentally. So when the high dose of vitamin B1 was given to that rat model, which prevented the development of diabetic nephropathy, which was a great achievement in recent research. In study, high-dose vitamin B1 therapy was shown to reverse the early stage of diabetic nephropathy. It is also now tried on humans. So when tried on humans, that they shown to reverse the early stage of diabetic nephropathy. 300 milligrams of vitamin B1, being thiamine, per day decreases the microalbuminuria. It means that the level of albumin ranging from 30 to 300 milligram. Another term, vitamin C and cancer. So vitamin C and cancer are also relatable. Despite of vitamin FDA not having approved the use of high dose of vitamin C, in spite of not approving the high dose of vitamin C for cancer patient, or we can say for the treatment of cancer, so the study shows that application of high dose vitamin C improved quality of life and for cancer patient, which means that vitamin C can improve the quality of a cancer patient, quality of life of cancer patient. Improvement in physical, mental, emotional functions, symptoms of fatigue, nausea, vomiting, pain, and appetite loss were documented. So when the high dose of vitamin C in cancer patient was given, or you may say was administered, so the improvement were observed in the physical and mental and emotional functions. So these improvements were observed, and the symptoms of fatigue were reduced, you may say, or you may say improved. Nausea and vomiting pain were improved, and appetite loss were documented. So the appetite loss was also improved. So this was about the vitamin C in the cancer. In the upcoming points, we will discuss about the another function of vitamin C with another disease. So this is about cancer. So now we will discuss about the another points, that is vitamin E and arranging of health issues with cardiovascular disease. Let's see their relation. A new research indicates that genotype matter also when it comes to vitamin E. Subpopulation with a specific genetic makeup may profit from this vitamin. A recent study into vitamin E and cardiovascular diseases showed that vitamin E supplementation at a dose of 400 mg reduces and normalizes the risk of cardiovascular events in diabetics. So, vitamin E is related to the cardiovascular disease, which means that if we have a high supplementation of the vitamin E at the dose of 400 mg, it will reduces and normalize the risk of cardiovascular diseases events that occur in diabetes. So it is another research about the vitamin E and the cardiovascular disease health issues. The next one, that is vitamin C and the common cold. Common cold and vitamin C are also related somehow. The common cold is a viral infection disease of the upper respiratory tract. Colds can be lead to the upper respiratory system becoming less resistant to secondary bacterial infection, resulting in issues such as middle ear infection, pneumonia, bronchitis, sinus infection, and strep throat. And that is a small definition about a common cold. The body immune system can fight the infection after producing antibodies, but there are currently no medicines that will cure the common cold. However, there may be a way to reduce the risk of contracting the common cold. A recent meta-analysis shows that vitamin C reduces the incidence, duration, and severity of the common cold when a greater or less 200 mg per day is taken daily. So the common cold is a viral infection which infect our upper respiratory tract, so which can lead to some kind of resistant diseases to bacterial infection, resulting in some kind of issues, or you may say that resulting in complications, that is middle ear infection, pneumonia, bronchitis, sinus infection, and strep throat. So our body immune system can also fight this kind of you may say infection. So but there is a if someone is immunocompromised, so she or he cannot fight that kind of infection, so there are no medicines. So medicines are also not available to cure that common cold. So what we should do then, we have a way, or you may say we have a you may say a fighter to reduce that risk of contracting the common cold. So that is vitamin C. So the meta-analysis shows that vitamin C reduces the incidence, duration, and severity of the common cold when the dose is 200 milligram per day or greater or equal. So this is about the vitamin C in the common cold, which is included in pharmaceutical importance. So means that these all vitamins are prepared pharmaceutically, or you may say they are extracted from their sources and packed in supplement, or you may say in tablets form, so in order to have it orally or some other kind of route. So this was about my today's video. Thank you for watching my video and keep subscribing. Okay, see you in my next video. Allah Hafiz.